Hi, everyone. My name is John Faulkner. I'm your host of the Smarter Systems, Better Care podcast, and I'm here today with Dr. Hilary Gallin. She is an MBA and is the co-founder of FastLine, which develops innovative devices to improve procedural efficiency, and ARX, which is a company that designs personal protective equipment tailored specifically for women in fields such as construction and other industries requiring safety gear. Thank you for joining us today, Dr. Gallin.
Thank you for having me.
Absolutely. And let's go ahead and jump right into it. Could you tell us a bit more about your background, your business model, and the clients that you serve?
Absolutely. I'll start with my background. I was a biomedical engineer in college, and after college, I then went and became an investment banking analyst at Goldman Sachs in their healthcare investment banking group. After investment banking, I went to medical school at Washington University in St. Louis. I then got my MBA at Harvard Business School, completed my residency and fellowship in anesthesia and obstetric anesthesia at Mass General Hospital, and recently moved to New York. In all of this time, I started ARX, which is, as you mentioned, a company that makes PPE specifically for women, and FastLine, which is a medical device company.
What's the core focus of your businesses today? Is there like an overarching theme of something you're trying to focus on? Just curious to hear your feedback on that.
It's funny. When I think about both businesses, what it really comes down to is solving an unmet need. And so these are both needs that I have encountered personally. And once I saw the problem, I couldn't unsee it. So FastLine is a device that helps place central lines more efficiently and more safely. And it came out of a need after being frustrated with my own experiences placing central lines, wondering, why do we place it this way? And is there a way to do it better? And together with my co-founder, who is actually a urologist, we were both colleagues at Mass General and friends from Harvard Business School. We realized if we are both having the same problem, then we can't be the only ones. And so let's think about a better solution. ARCS came out from a similar experience where I was actually injured on the job site. I was in the operating room and I had laser safety goggles that fell off my face and ended up in the
Wow.
emergency room.
Yeah.
And it was a really scary moment to realize that your gear doesn't always protect you if it doesn't fit well. And then I realized it was really hard for me to find gear that actually fit. So together with my co-founder, who's a real estate developer and former engineer on a construction site, we realized again that we were both having the same problem. And so from there, we wanted to tackle the issue of creating personal protective equipment that fit women.
And then if you had to explain like your competitive edge for one of the businesses or one you're primarily working on right now, what would be like something you would say to someone or potential client? Curious to hear like what you would say to them.
Sure. I'll start with FastLine. I think that there's a lot of power in designing something as the actual user. And so when we ask ourselves the question of why have central lines been placed the way that they've been placed for over 50 years, we realize that the people who are designing it are not the ones placing the central lines. And if you ask anybody on the front line, they can tell you all of the workarounds that they're doing and what they do to adjust the current equipment. And you realize that there's this major disconnect. And so I think the power of us starting this company is that we're both physicians and we both have backgrounds in engineering. So we can speak a couple of different languages, whether it's speaking to physicians to understand the problem, talking to our engineering team to improve the product, or pitching to investors and making that case. But it's really the power of connecting the dots, having a foot kind of in each of those arenas.
Absolutely.
I think it's a great question.
Yeah.
I think you're on something, which is different people are going to care about different things in your
Yeah.
business. So physicians will care about one thing. When it comes to investors, we focus more on the market opportunity, decrease the potential to decrease complications, decrease healthcare costs. When we talk to physicians, we talk about ease of use, patient safety, and efficiency. And so we highlight different things depending on who we're talking to. But the great thing is that no matter who you are, there's something valuable to you, and our incentives are aligned.
Excellent. And then kind of getting back into the industry a bit more too is like, what's like a shift in this industry that you think most founders, operators are underestimating at this time for someone who may be, developing their own device or having their own ideas or, someone working in, this PPE market? Just curious to hear your perspective.
I'll start with the device question. One of the things we have with FastLine is that in the last 10 years, an ultrasound has become the standard of care. So when we normally place central lines, we have a kit, it's about this big, and it requires use of two hands. So I need one hand to hold the needle, another hand to stabilize a wire. And so it's a lot of two-handed motion. But then I have an ultrasound and I really need a third hand to hold it. And so what we made was a device that takes all of those steps and puts it into a one-handed device so you can hold the ultrasound in the other. And so I think as you look at different physicians, you have the older physicians who are not as comfortable using the ultrasound. But the great thing is that you have a new wave of physicians who are very comfortable with technology. And I think that that's what we're starting to see, whether it's imaging or use of AI, is that we have kind of a new set of people who are adapting to that very quickly. And so I think that's where some real opportunities lie.
Yeah, absolutely. Different people, your different backgrounds, different experiences of how they've done it, different entry points. Like you said, they new residents going and becoming an attending or new fellows. They have different experiences from where they came from, and this is kind of bringing it all together from them in a way that it's easily digestible because they can understand 3 hands to 2 hands is a huge improvement. Absolutely. And then how is the industry adapting to like specifically like innovative devices or things that you're working on? Are they having a similar mindset as you of like from the perspective less on the market and more of the people using the device? Or what have you seen other companies do?
There's been a real push in the last few years to focus on patient experience,
Hmm.
patient safety, user experience. And I think that's a great, I think that that's where we find ourselves making progress, is that people are finally paying attention. It's not just about the outcome, but really about the experience of all involved.
Yeah, absolutely. Like, and do you mind expanding more on that experience piece? Like what kind of things could come to mind when you mention experience?
Sure. Things I think about are, is it easy for the provider? Does the kit include all the pieces? Is it more efficient? There's a medical device company that I'm an obstetric anesthesiologist. I place a lot of epidurals. And so they're creating a device that allows imaging of epidurals, and they're trying to make it, easier for the patient to get the epidural, easy for the physician, but every part of their experience is focused on making it easy. So making sure that it's easy to assemble the kit, making sure that it's really easy, the battery doesn't run out. And all of these components that seem small actually really impact your ability to use the device. I think that that's where we're starting to pay a little bit more attention.
Absolutely. And then kind of in your own business, like what are you doing to adapt to like new emerging technologies like AI, especially with like devices and things that you're working on? Is there something in particular you're doing to adapt or what does that look like in your business?
FastLine itself is a manual device. We purposely didn't want to have any electronic components. We wanted to make it very simple. We wanted to make it disposable. And that was an intentional choice to make it as easy as possible to access and to use. There are other companies that have kind of AI guided imaging and will automatically deploy your needle. And we purposely wanted to be on the other end of the spectrum. Where I think that we can play nicely with AI is to have partner with an imaging program or something that helps you kind of locate your needle and locate the vessels and what you're trying to do based on the actual image. But we actually really wanted to retain the user autonomy, that because we're dealing with such high stakes vasculature and anatomy, that we wanted to make sure that it was as easy as possible for it not to break. The other part is that to have these very sophisticated systems require a lot of CapEx investment. And so we see that some hospitals don't want to buy a very expensive system, one, because you may only have one or two and it wouldn't fit the needs of the entire hospital where there are thousands of central lines being placed. And the upfront costs are just too high at this point in time. And so we purposely positioned ourselves away from that.
And I think you're highlighting the real critical piece here too is like saying sometimes the answer is just keeping it simple. Keep it simple to make it easier for people to give them the solution they're looking for, right? How do you kind of market yourself as you're growing?
Our physicians. We are partnered with a few key opinion leaders and we're speaking at conferences, and that's how we're doing it, but really going after the physician first, especially because we're very early stage. But that's how we have user testing across the country and input from a number of different people. But it's really through our own personal network.
That's a great idea. And are you guys in more of like a pilot phase now, or what phase are you at right now in your business?
We are kind of in advanced prototype development. So we've done a few animal studies, we've created a couple of prototypes, but we're definitely not ready for the market yet.
For market yet? Yeah. It sounds like you're getting really close though from what you're been describing. Like you're getting a lot of great input and feedback, it sounds like as well.
Yeah, one day at a time. I think that that's the
Yeah.
other part, is you have to be really patient. We want to make sure we make the best device possible, and that's going to require a couple iterations. So we're very happily enjoying the process of tweaking our prototype and thinking about what's next.
Yeah, absolutely. And then kind of talking like bigger picture, this is more like systems and efficiency gaps. Like what are the pain points in your operations today as you're like working day to day, trying to solve problems? Like what do you guys run into for issues? when you're working through these things?
In terms of FastLine or something
Yeah,
more?
yeah. In terms of FastLine, or ARX as you're working in your business, are there specific pain points that your team runs into that they have trouble solving or are moving on to the next step?
I think for both, it's always a question of when you want to do your design freeze. You
Okay.
can
Yeah.
iterate infinitely.
Yes.
You can always try to make something that's perfect, and there's always someone who's going to have an opinion about making something. And I think the biggest challenge is kind of parsing through that feedback and trying to figure out like what's signal and what's noise. At some point, you do have to freeze your design and introduce something into the market. So for ARX, we made a vest and we made some changes and we decided to hit go on production. And so our vest is in the market. We've gotten some really positive feedback, but we definitely are going to add a couple different design features for our next generation vest, which is in production. So
Excellent.
I think it's always a hard question of you can't wait forever to release something to the market, but you also want to feel really good about what you do, knowing that your final product should look very different than your first product.
Yeah. So the different versions of that product and show like not necessarily drastic changes, but showing that you receive feedback and you made modifications to make it better, right? So
Exactly.
that makes sense. It sounds like too for a lot of your business, you're doing like a lot of referrals, like word of mouth at first. What's your vision for growing like in the next, like once you get to the next phase of like getting to market, like how do you want to grow? Like how do you envision that?
For ARCs, we are selling direct to consumer on our website at the moment.
Okay.
We launched 2 months ago, so we're still very early.
Yeah.
We're about to start a social media ad campaign. We're actually using AI in our marketing. And so I think it's really thinking about what's the most efficient way to reach a large number of people.
Yeah. Definitely get the word out. And
Mhm.
it sounds like, are you still trying to figure out like who you appeal the most to? Cause I know like for your PPE, you're probably, it's women, but is it like women in specific specialties or is it kind of just like women across like in construction and healthcare and different industries?
So we created an ANSI certified vest, which means it follows the OSHA guidelines for use in industries that require PPE. So these industries can include construction, oil and gas, your crossing guard, manufacturing. There are many, many, many
Many uses.
people who wear high vis construction or high vis PPE. And so we're starting with that. It's a little challenging in this industry where your end customer and your end user may be very different. So
That's a good
people
point.
acquire PPE in all different ways. And
Yeah.
so some people will get their PPE through their company from like a safety manager who purchases the vest and they will give it to them. Other people will buy it themselves and get reimbursed by their company, and other people buy it independently. And so, as we think about scaling, we're trying to kind of understand the needs of all those different groups.
And then with like women's vest and PPE, what are the unique features that you've designed just out of curiosity or feedback that you're getting to make it better too? I'm curious on that process.
So, the trend in the market currently is to take a man's vest, make it smaller, and make it pink and call it a women's vest. And so we call it that's the shrink it and pink it model. And the truth is that women and men have very different shapes, very different proportions. On average, our torsos are different lengths. And so we wanted to create something that was designed specifically for a woman, not just something that was smaller, but truly had a shape that was complementary to a woman. We call it pockets in all the right places. And, the ability to adapt to their body and make it really comfortable to wear. And so in our next iteration, we're going to tweak some of the pocket sizes as iPhone sizes are changing
That's a
and
good
we
idea.
want
Yeah,
to, you know, some of the positions of things, but it's mostly going to stay the same. I think it's just when you have more feedback and you open up to an audience, you really want to make sure that you can be responsive to that.
yeah, absolutely, for sure. And then kind of getting more into like results and like bottlenecks again, like in your businesses, like what's working really well right now, and like on the opposite end of the spectrum, like what's been harder than expected as you're working through things.
I think the timeline is always challenging. Like you want to make decisions quickly. You want to get your product out the next, tomorrow, but you also want to make sure that you have a really good product. And so working with your engineers, working with our factory, making sure that we're really proud of the product before it goes out, whether it's the fit or the quality has been something that just takes a little bit of time, but we're very patient. We want to make sure that we don't rush something just to get it on the market.
Absolutely. You want to get it just right, but not like necessarily perfect, but like to the point where you said you got to figure out where we're going to freeze it and then
Yeah.
move on to the next step, right?
Absolutely.
Absolutely. And I know you're still kind of early on, but are there any specific metrics that you measure or your KPIs? Like, do you keep things in mind as things are growing, or maybe there's new metrics you're considering to use for success? I'm just curious about that too.
For ARCs, because FastLine is not on the market yet, we're looking at our sales, we're looking at our input costs, we're looking at our marketing budget. One of the questions we get asked a lot is we manufacture overseas. So what is that going to look like in this climate? I don't think anybody really knows. And so we're just making sure that our costs are controlled and that our investment in our advertising has a high return.
Yeah, absolutely. Get a good ROI.
Mhm.
And then let's say you guys solve all your big blockers, like you've narrowed down like your freeze periods for your products, like what does success look like in 6 to 12 months for you guys? I know that's
Mhm.
sometimes like in a founder's world, that's a long ways to think, but what's your vision?
Our vision is to be a trusted brand for women and be a head to toe solution. So we're starting first with the reflective vest. We
Hmm.
want to know our customer, focus on one product, and then from there, grow our product offering. So we're really excited to have more products come online in the next 6 to 12 months and hope to be a one-stop shop for any lady on the job site.
Absolutely. Yeah. And it sounds like you're definitely getting there for sure. So that's excellent.
One day at a time.
Yeah, exactly. And it's like kind of getting along to that, like one day at a time. Is there like anything you guys need to figure out? Like if you were to triage, I guess, the issue, anything you figure out like right now that's like top of mind?
It's a great question. I think right now our next question is how to effectively advertise online and
How to
making
figure
sure
out.
that we have the right message
Yeah.
and that we're reaching the right
Yeah, absolutely. Like organically trying to reach out to them.
Mhm.
Right. Yep. Makes sense. And then we're kind of at the end of the podcast here, but where can people find you if they want to connect with you, have a maybe reach out for a conversation? What's the best way to do that for you?
I'd love to connect with anybody in your network, so please reach out. You can find me on LinkedIn, or you can find us on our website at www.shoparxppe.com.
Excellent. Well, thank you for joining us on the podcast. And it was a great conversation. Thank you for your time today.
Thank you for having me.
Yeah. Thank you.